Today, I would like to share some details about epilepsy and the misconception about the treatment of epilepsy in India. Epilepsy is one of the commonest disease what we see in neurology OPD after headache, which is the most common neurological complaint. Epilepsy is called in various names like fits, convulsions. In Hindi they call it as Meghi, and Kannada they call it as Murcharoga. So what happens in epilepsy is there is an abnormal electrical discharge in the brain, and when this increases you can see seizures or epilepsy happening in the body. The seizures can be in a form of loss of consciousness or jerking involving both the hands and legs, or it can be only brief unawareness or jerks involving only one part of the body. In India, about 6 million people are suffering from epilepsy, and about 1/3 of them are treated with medications at this point of time. About 2/3, that is about 75 to 80% of the people, do not have access to any medical care for treatment of epilepsy at this point of time. Epilepsy is not a psychiatric disease, or it is not a misconception, like it is not possessed by any evil or any other disorder. Epilepsy can happen to everyone from children to an elderly. Most commonly it affects children below the age of 1 year to about up to 5 years, or it can happen in elderly after the age of 60 years. There are many causes for epilepsy. The most common cause for epilepsy is related to brain infections like meningitis, encephalitis, which is common in India. The other common causes are head injury, brain tumors, and some kind of a genetic disease which can involve the brain, which can cause seizures early in the childhood. Most of the seizures or epilepsy can be treated with oral medications. Of late, we have various new medicines with minimum side effects which can be even used lifelong or for a long time without causing any major adverse reactions in the body. Most of them receive medications for a period of about 3 to 5 years, and about 70% of these people get cured or controlled with these medications, and more than 2/3 of the people can stop medicines after 3 to 5 years. When do you decide to stop medicines? We decide to stop medicines when an EEG is normal, someone does not have seizures, and MRI does not show any changes in the brain. If by chance the seizures recur after we stop the medication, then we give another course of medicines for another 3 to 5 years and see whether if we can stop the medications or not. If not, these are the candidates which can be worked up for something called as epilepsy surgery. You find some cause for epilepsy in the brain, we can operate on that part of the brain which is causing epilepsy, and we can treat this patient with epilepsy surgery. And next, coming to a little bit about first aid of seizures and epilepsy. What should one do when someone gets seizure at home? The most important thing one should do is that do not panic. Always leave the person free on the ground, or move the person away from dangerous things which are around the patient at the point of time. Wait for the seizure to end. Once the seizure ends, put the patient in a lateral position so that you can drain off the saliva from the mouth. Once the patient regains consciousness, talk to the patient, reassure the patient that seizure is over, and then if he has missed his medications, you can give him his medicines once he is fully conscious and he is able to swallow. When he is still drowsy or unconscious, do not feed anything through the mouth. Do not put your fingers or any other metallic objects into the mouth, because it is going to cause more injuries to the patient rather than protecting his tongue from getting bitten due to seizure. What you are not supposed to do when seizure is happening is that do not hold the patient arms or legs, do not constrain him, leave him freely so that the jerks can happen freely. Always see that move the crowd away from the person so that the person can breathe good air. The third important thing is do not put anything in the patient's mouth, because it is going to cause injury to the patient as well as the person who is putting his fingers into the patient's mouth. The last but not the least, the most important message what I would like to give at this point of time is, you may be the first person to bring a change in the treatment of epilepsy. Treat epilepsy, avoid further brain damage. More the seizures a person can have, more likely he is going to injure his brain. Thank you.